You're fine in your 20s and your 30s, and then you start seeing your friends, things start happening to them.
Men are growing out their beards this month to raise awareness for men's health.
This might be my last night. I might not wake up and see my daughter ever again.
A new treatment is giving hope to patients with type 1 diabetes. And a documentary is shedding light on the sperm donation industry. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Michael George. We begin with a look at the incoming Trump administration's healthcare policy. Former President Donald Trump has suggested he'll scale back the nation's public health insurance programs and make other changes that'll affect everything from vaccines to reproductive care. For more on what we can expect, I sat down with CBS News medical contributor Dr. Celine Gounder. Dr. Gounder, thanks so much for joining us. So we've got a new administration coming in, and a lot of people have some questions about what this means for health. And I think first off, we're hearing a lot of talk about reproductive health and abortion. Will that be curtailed? What should people know as we head into this new administration?
Well, I think there are two main things on this front that I will have an eye on. So one is what is going to happen with medication abortion. Mifepristone, the FDA approval for mifepristone was challenged in the courts. The Supreme Court ruled in favor of maintaining the FDA approval, keeping that in the market in states where it is legal. Now, the real question is whether Trump administration could basically just withdraw that approval for mifepristone, somebody who Trump appoints, which would then make medication abortion unavailable in any state. The other issue in terms of abortion is what we call EMTALA. It's a federal law that says that if you come into an emergency department, you have to be medically stabilized or transferred to another facility that will stabilize you before you can be discharged. And there have been a number of cases now involving women who had pregnancy-related complications, may or may not have involved in abortion at all, but who were discharged from the emergency department, who in some cases went on to die because of complications that were not addressed early enough. There is a Biden administration lawsuit around ensuring that EMTALA protections are enforced, even if there's something pregnancy or abortion related. But it remains to be seen if that lawsuit will continue.
I also want to talk about the Affordable Care Act because Donald Trump has been sort of inconsistent on this. At times he said he's getting rid of it. At times he said he isn't. Do we have a sense of what the future of the Affordable Care Act is?
Well, the last administration, his mantra was repeal and replace. I don't think we're going to see that again for a number of different reasons. It's a very popular law. A lot of people have benefited from it. It's probably not feasible to get a repeal and replace through Congress. However, there are ways to chip at it, as has already been done. And so a couple areas are the enhanced subsidies that were passed during COVID that were extended, which have allowed people to be able to afford to purchase these Obamacare or marketplace health insurance plans. So if those subsidies go away, a lot of people may not be able to afford to purchase those insurance plans.
A lot of people are also looking at RFK Jr. Donald Trump has said that he wants RFK Jr. to play a big role in health, in women's health in particular. Are we going to be watching what his influence is, especially with the FDA?
It's a really good question. So many of the issues that RFK Jr. is passionate about, whether that is vaccines or having access to drugs, medications that have not been proven effective in clinical trials that would not normally pass the FDA approvals process, to food. He's also been railing against ultra-processed food and preservatives and various additives in food. All of these things would be falling under the purview of the FDA. That also means taking on big industry interests like pharmaceutical companies and food industry. So whether that will actually come to fruition remains to be seen. As we know, the former president, soon to be president again, has made promises to many in the past that he has not followed through on. Some of what we're hearing now is that maybe RFK Jr. will not have a appointed position such as the FDA or HHS, but rather some sort of senior advisory role where he could still have quite a lot of influence over policy.
Okay, we'll have to wait and see. Dr. Gounder, thanks so much for joining us. We appreciate it.
My pleasure.
As the days get shorter and colder this time of year, seasonal affective disorder may take hold. According to an American Psychiatric Association poll, nearly 40% of Americans say their mood declines in the winter, and a quarter report feeling depressed. Patients with seasonal affective disorder, or SAD, can feel fatigued or less motivated, and they may not be able to enjoy their normal activities.
Try to get outside as much as possible. There's plenty of light to be had in the wintertime.
Psychology researcher Kelly Rowan says treatments for severe instances include antidepressant medications, bright light therapy, and cognitive behavioral talk therapy, as well as just sticking to a routine.
The end of daylight savings time is a really big trigger for a lot of people with winter depression. They tend to come out of the work for that first time on Monday, and it's suddenly dark, which was not the case the Friday before.
Experts say light therapy can help people feel improvements within 2 to 3 days of regular use, and a full response is seen within 3 weeks. Many parts of the country are also experiencing an extended spell of dry weather. This can increase respiratory problems for people with conditions like asthma. Stephanie Stahl explains.
9-year-old Bryce Shaw loves being outside with his mom in South Jersey, throwing around a baseball. But lately, it's been difficult.
It's like hard to breathe a little.
The third grader and his mom, Michelle, both have asthma.
It's scary to me. You know, I have to wake up and I often say, wow, I'm wheezing.
Doctors say the extended period of dry air during this drought has triggered an increase in respiratory problems.
So we're seeing a bit of an uptick in patients with respiratory disease coming in with what we call an exacerbation or sort of a worsening of their asthma or COPD.
Dr. Heather Giannini, a pulmonologist at Virtua Health, says the dry air inside and outside is full of dust and other substances.
It's more of these allergens enters their lungs, irritates the lungs, sets off an inflammatory process, and then can trigger what we call bronchospasm, where the airways get tight. That's when they start to feel wheezing, shortness of breath, difficulty getting those breaths in and out.
And then this device goes into my mouth and I breathe in. Normal breathing, so it gets down into my lungs.
Shaw uses a nebulizer with medication to help clear her airways.
My coughing, my wheezing, shortness of breath has been subsided.
And Bryce uses an albuterol inhaler every morning.
It like calms you down and it's easier to breathe.
Doctors also say humidifiers inside the house can help offset this dry weather, and so can steam from a hot shower. I'm Stephanie Stahl, CBS News, Philadelphia.
Well, for many men, November is Movember, a month to raise awareness of men's health issues such as prostate cancer, testicular cancer, and mental health by growing out their facial hair.
You're fine in your 20s and your 30s, and then you start seeing your friends, things start happening to them.
Men are less likely than women to seek preventative care. A Cleveland Clinic survey of 1,000 adult men found more than half don't get regular health screenings.
You want to know your numbers, your blood pressure, your lipids, your cholesterol, your blood sugar. Do you have diabetes? And especially also immunizations. Guys tend to not get the HPV vaccine, which can prevent cancer, human papillomavirus.
It's recommended men start colorectal cancer screenings at age 45. New data from the CDC shows teens are spending too much time in front of a screen. We took a look at the issues it can cause. Teens are spending more time in front of screens in recent years. Now, new findings from the CDC show about half of teens had 4 hours or more of daily screen time.
Research shows actually that social media use is more likely to have harms if it exceeds 3 hours per day, so I think those rates are concerning.
High amounts of screen time have been linked with poor sleep, fatigue, and anxiety and depression. This survey finds about 1 in 4 teenagers with 4 hours or more of daily screen time experienced symptoms of anxiety or depression in the past 2 weeks. Dr. Tamar Mendelson with the Johns Hopkins Bloomberg School of Public Health says parents need to understand what social media use is healthy and unhealthy.
And is it interfering with the day-to-day kinds of activities that promote positive development for young people? So that includes healthy bedtimes, having dinner with your family, spending in-person time with friends, and doing sports and other after-school activities.
Dr. Mendelson adds that parents should set boundaries and limits and keep the lines of communication open.
During COVID, I kind of looked at my screen time and I was like, wow, I'm spending more than half of my time awake on my phone. Something needs to change.
This group of teens is part of the Luddite Club, formed at some New York City schools, named after a 19th century movement opposing industrialization. Former teacher Amanda Hannah McClear is now making a documentary about the teens' commitment to kick their phone habit.
When there's no phones around at a Sunday meeting, they are drawing, painting.
helping teens develop more connections in real life. There's a growing debate over the $5 billion sperm bank industry and how it's leading to some devastating consequences for children. Lee Kanairi reports from London.
Louise McLaughlin was 13 when her parents told her she had been conceived by a sperm donor.
It felt like the rug was just pulled from underneath my entire life.
She was raised an only child in Ireland, but in her 20s signed up for genetic testing, discovered she had a half-sister, and not long after that...
Oh my God, we found our biological dad. We found him within a few hours, and he had a website, and I called him that day. I have a million questions. You might have a million questions.
Yeah. I was in London and I did donate at a clinic there.
Mm-hmm.
You're very welcome to have called me.
And to hear this man say you're very welcome, I feel guilty because I know that that's not the story and that's not the happy ending that everyone gets.
Why are you putting so many children on this earth?
A recent Netflix documentary sparked debate about a largely unregulated industry. It featured Jonathan Mayer from the Netherlands, who was able to father hundreds of children.
I am a very good donor. I am one of the best donors.
His donations may have reached America. The U.S. does not have a national database tracking sperm donation, and there's no legal cap on how many donations can be made by one person, making it possible for those born to end up in incestuous relationships without knowing.
Donor-conceived people have been sounding the alarm on this for years, but we are seeing men who are donating hundreds and thousands of times.
Indiana law professor Jody Madeira is an expert in fertility fraud.
How does the U.S. compare to other countries when it comes to regulating sperm donation?
Well, I think the Wild West is an apt comparison. And if you think that something like a guy with 1,000 kids, donor-conceived kids, is possible in Europe, then the chances are exponentially higher in the United States.
From shady secrets to life-changing discoveries.
Louise now hosts a podcast, You Look Like Me, that explores the lives of people like her, some discovering they have huge biological families.
This journey of conception, this journey of fertility treatment, it does not end when you have a baby. It ends, all the way in the future when your child is grown up into a person, and these are real world issues that they have to deal with.
Louise says making parents aware of those risks could improve the donor industry. Lee Kanairi, CBS News, London.
Coming up, a surprising number of law enforcement professionals have suffered a head injury, and creating awareness for people suffering from nonverbal learning disorder. Welcome back. When we think of people who suffer concussions, athletes probably come to mind. But a new study is putting the spotlight on an often overlooked population for concussion surveillance. Franklin County Deputy Sheriff Josh Walters says in his line of work, concussions typically aren't on the radar.
When we get injured in something, we're looking for holes and blood leaking, not necessarily how dilated your pupils are, because you just smashed your head on something.
Walters co-authored a recent study that looked at concussions among law enforcement professionals. The survey of 381 personnel in Central Ohio found 74% reported a history of one or more head injuries. For nearly a third, it happened on the job. And those with injuries reported more PTSD and depressive symptoms.
So many of these injuries are going untreated. Many unreported and then untreated.
Jacqueline Cassis is an assistant professor in the School of Health and Rehabilitation Sciences at Ohio State University Wexner Medical Center.
I think one of the things that we're hoping this survey will do is increase awareness among law enforcement officers and the public more broadly regarding head injuries outside of the sporting context.
Additionally, injured officers aren't always able to get immediate treatment for concussions due to the demands of their job. Walter says the next step is working on a return-to-duty protocol, just as they have in sports and the military.
If you're going call to call and you've just received a concussion and now you're dealing with a high-stress situation, it's very hard to break all that down and make those really hard decisions fast.
Researchers hope their findings will lead to better outcomes for officers not only in their career, but also in retirement. It's estimated more than 2 million children and adolescents in the U.S. may have nonverbal learning disorder, or NVLD. The condition affects a person's ability to problem solve, notice patterns, and learn concepts. Jared Hill has one family's story.
I always known that I was different.
Ariel Miller says it was things like playing by herself and problems with organization that tipped her mom off when she was young.
I was always alone and spending time doing my schoolwork instead of interacting with people, which was really scary for me.
Now 33, she's been living and coping with nonverbal learning disorder, or NVLD. It affects nonverbal skills, especially understanding visual spatial processing.
This might be the ability to pack the back of the car well, or to follow the instructions to put together a piece of IKEA furniture. For children, when they learn to do jigsaw puzzles, or when they're using Legos and have to follow the instructions. And then in school, it becomes incredibly important when they have to interpret pictures or read graphs. And they also may have trouble with math and with motor skills.
Ariel's mom, Laura Lemley, started the NVLD project just over a decade ago, hoping to build a community for families like hers and create awareness for NVLD to officially become a disorder classified by the American Psychiatric Association.
We're really hoping to get NVLD recognized as a formal disorder in the medical community.
There are also efforts to change the name.
The first thing people think is they're mute or they don't talk. The new name proposed for NVLD is developmental visual spatial disorder. You can describe visual spatial issues like getting lost in space, not understanding what's salient, not reading nonverbal social cues.
NVLD has been gaining attention since Chris Rock revealed his diagnosis, and Minnesota Governor Tim Walz revealed his son has NVLD. Ariel says she hasn't let the disorder hold her back.
I still have NVLD. So I can't say I overcome it, I don't have it anymore, but there are easy ways that you can make it easier for yourself.
And she's taking it one step at a time. Jared Hill, CBS News, New York.
After the break, the extremes that some people in China are going to lose weight, and a new way to fight diabetes. Welcome back. A groundbreaking treatment for type 1 diabetes is showing promising results for patients in Chicago. It's a minimally invasive procedure that could mean diabetics don't have to inject themselves with insulin. Darius Johnson spoke with a patient whose life has changed for the better because of it.
Here at UChicago Medicine, life-changing transplants are being conducted for type 1 diabetic patients.
This medication has a great potential to be less toxic to the patient and be more beneficial, providing better outcomes in islet transplantation.
That medication is tegoprubart, modified over the last 25 years to help bring positive results for type 1 diabetic patients who use insulin, patients like Marlena Godell.
I have so much more energy. I feel so free.
For 25 years, she has lived with type 1 diabetes. She calls it chaos from age 5 until now.
I would go to sleep at night and think, this might be my last night. I might not wake up and see my daughter ever again.
She says her tipping point was when her daughter found her on the floor after her sugar crashed. She then talked to 3 doctors about islet cell clinical trials and got nowhere until she researched.
I emailed the University of Chicago and essentially just wrote out my entire life story and just saying, please help, I've had enough.
That was last October, and on July 17th, she went in for her procedure.
I have a really cool scar. I show everybody who will look at it. They just kind of made a very small incision and then injected the islet cells into my liver because, well, my pancreas don't work, so they injected them into the liver.
3 weeks after the procedure, she was off insulin. For that, she thanks her superhero, trial co-investigator Dr. Peter Wachowski.
Her life was severely compromised, and she couldn't live like this anymore.
3 months later, she's living a life like never before, which often includes double cheeseburgers.
It's been great, and I'm just looking forward to helping the other diabetics get their hope back.
Darius Johnson, CBS News.
More than a third of China's population is considered overweight or obese, according to the World Health Organization. While that's still far less than the rates here in the U.S., many people in China face serious public pressure to slim down.
For fat people also, they are stigmatized in many societies in China because fatness is perceived associated with laziness, sluggishness, and lack of self-discipline.
That sparked a fitness craze, with some people going to weight loss camps to shed serious weight. This 23-year-old woman has lost about 60 pounds since July. Her parents pay about $400 a month. The camp has strict exercise regimens, mandatory trips to the scale, and surveillance methods to prevent snacking. Experts say K-pop and Western pop culture has influenced many people in China. But there are risks for people attending these camps. An influencer died last year while trying to lose more than 200 pounds.
The government should monitor and restrict extreme workouts and diets and other, potentially dangerous ways to lose weight. And also many camps are, fraught with poor services. All of these really need streamlined by the government.
In China, obesity is the 6th leading risk factor for death and disability. We'll finish back here in the States. The nonprofit Food Rescue US collects excess healthy food that would have ended up in landfills and distributes it to local agencies. The organization is active in 23 states, and the World Bank is one of their partners. Natalie Brand looks at how they're working together to combat food insecurity.
On a busy week at the World Bank, the kitchen cranks out up to 8,000 meals. What's not consumed, Chef Nick Cavaretta and his team carefully package and prep for donation to organizations in need.
We love statistics here at the World Bank, so we just get a weight on everything so we can monitor exactly how much food gets donated.
Cavaretta estimates up to 900 pounds any given week, 25,000 pounds over the past year.
You showed us all this beautiful food. It would have been painful to throw it away.
Yeah, of course. I mean, perfectly edible.
Volunteers from the organization Food Rescue US DC pick up the leftovers weekly and deliver them on this day to a facility that provides housing to veterans who have experienced homelessness. Lisa Harris, who served in the Air Force, says when her food stamps run low, this is what fills the fridge.
You may not think it, but you never know when you might be in this position. And I'm telling you, not knowing where your food is going to come from, not knowing what you're going to eat, it's hard. It's very hard. And we are appreciative.
Kate Urbank of Food Rescue US's Washington, D.C. chapter says her group serves a dual mission, fighting hunger and climate change by keeping the food out of landfills and redirecting it to nonprofits.
When you think about the fact that 30 to 40% of food is wasted and over 45 million people live in households experiencing food insecurity, it just makes a lot of sense to do the match.
For institutions like the World Bank, where ending poverty is the mission, it's a win-win.
If you can just help one person, it would be like a shame not to do that.
When you got food like this, people, please donate.
Lisa Harris hopes more organizations heed the call. Natalie Brand, CBS News, Washington.
That's this week's Eye on Health. I'm Michael George. Thanks for joining us and be well.